again, if we look at the two demographics, for the elderly, especially after a fall, the incidence of hip injuries is probably higher. And I would probably more strongly recommend them see a doctor early after if they're developing hip pain. For the younger patient, often after a sports injuries, usually we recommend it to rest, ice it, and maybe take some Panadol or some short course of anti-inflammatory. And if it continues after 2 or 3 days, then it's probably worthwhile getting a checkup by a doctor. So usually, on seeing a doctor, the doctor will ask you a lot about the mechanism of injury. So if you can remember what the mechanism of injury was, and they'll often ask what sort of sports and you play and how active you are. And we often recommend to bring in any regular medications you may be taking, and so that at least we know what you're on, and we don't want to prescribe anything that can interact with those medications. Then we will examine the patient, and you'll undergo a full physical examination. For the assessment of the hip, in general, there are two main radiographic investigations. One is just a plain X-ray, and for the elderly, usually that's sufficient. That can be, from that you can see either fractures or arthritis of the hip. For the younger patients which may have more subtle injuries such as muscle tears or ligament tears, then an MRI scan would be better to be able to pick those things up.